Good day to everyone. I'm Johnny Balmeo and I will be your clinical instructor for this subject, NCM 112. And today we're going to have a little discussion about this one, the tracheostomy. Okay? And also we will have a discussion about the tracheostomy. So for today's agenda, we will have a little overview of the tracheostomy. We will have a little discussion on why it is being done and what are the risks. Then later on, we will have a demonstration of taking care of the tracheostomy. So first things first, what is tracheostomy? Tracheostomy is actually a hole that the surgeon make through the front of the neck and into the windpipe. Well, in short, tracheostomy tube is actually placed into the hole to keep it open for breathing. And the term for the surgical procedure to create this opening is what we call the tracheotomy. The one that we are seeing right now is actually the tracheostomy. But for this one, this is actually a metal. Okay? So I have here some of the tracheostomy na usually makikita po natin in a hospital. This one, this is actually the plastic. Okay? We have different kinds of the tracheostomy actually. So later on, we will discuss about this tracheostomy and also the parts. Okay, don't forget the surgical procedure that we use or being conducted, this procedure to create this opening is what we call the tracheotomy. The one that we are placing or the instrument that we are placing in the tracheotomy is what we call the tracheostomy. Okay, this is the tube that is being placed into the hole to keep it open for breathing. So the tracheostomy actually provides an air passage to help you breathe when usual route for breathing is somehow blocked or reduced. Okay, magagamit po natin ito. And also in rare cases, an emergency tracheotomy is performed when the airway suddenly block, such as after a traumatic injury to the face or neck. Okay, what else? Tracheostomy is often needed when health problems require long-term use of the machine or what we call the ventilator to help you breathe. Okay, makikita ninyo usually na ICU, nakasaksak po dito, tapos andito nakatusok yung ventilator. Okay, pero makakakita rin kayo, for example, in the ICU, the ventilator is connected dito sa my mouth. So, sir, tracheostomy po ba yun? Actually, no. That is what we call the endotracheal tube. Okay? Usually, makikita nyo ang ET tube or the endotracheal tube sa may operating room, sa may ICU. Makikita nyo usually po ito. Saan pa ba? Sa may PACU, pwede nyo rin po siyang makita. Okay? But for some cases, hindi ET tube ang ginagamit natin, especially for long-term use of the ventilator. Ang ginagamit na ng iba, well, actually, it depends on the doctor. Okay, what they are using is the tracheostomy. Pang long-term po ito. Pero kung short-term lang naman, ang pagde-deliver ng oxygen, okay, ang paggamit ng ventilator, the endotracheal tube will be enough. Don't worry guys, kasi pag-aaralan din natin ito in our next topic. Okay? So, what else? Why it is actually being done? Bakit ba ginagawa itong tracheostomy? Okay? Situations that may call for a tracheostomy include medical conditions that make it necessary to use breathing machine or the ventilator as what I have told you for an extended period of time, usually more than 1 or 2 weeks. Pero as I have said, if you're going to use the ventilator for a short period of time, the use of the ET tube will be enough. Okay? What else? Medical conditions that block or narrow your airway, such as a vocal cord paralysis or throat cancer, the tracheostomy will be helpful for that. Okay? I remember we have one patient before, he got cancer actually, oral cancer. So we weren't able to deliver the ET tube because of the condition. So what the doctor did is gumamit po ng tracheostomy. Okay, tracheostomy will be best option for that. Okay, what else? Paralysis or neurological problems or other conditions that make it difficult to cough up secretions from your throat. So this one will be used for that. Okay, sa mga maraming nagkaroon ng build-up ng secretions, okay, we will do suctioning directly dito sa into the tracheostomy. Okay, what else? Preparation for major head or neck surgery to assist breathing during the recovery. Okay, we will also use that. And what else? What else? If there are some build-up of secretions in your trachea and it's really difficult na i-suction siya sa may oral or dito sa may mouth kasi meron tayong gag reflex, ma-activate yun. So, ito yung gagamitin natin. This is the best option for that, okay, the tracheostomy. What else? Severe trauma to the head or neck that obstructs breathing. Okay. What else? Other emergency situations when breathing is obstructed and emergency personnel can't put a breathing tube through your mouth, okay, and into your trachea. Are you familiar with this picture? Okay, this picture was actually seen from the Anaconda Part 1. Kung makapapansin niyo dyan, the actor has actually got anaphylactic shock, I think, anaphylactic reaction. So, nahirapang makahinga yung actor dito. So, what another actor did is, he made a cut dito sa kanyang trachea and then he inserted yung body ng ballpen. Okay, so, the one who's been suffering from the anaphylactic reaction was able to breathe. Okay, dun po sa may body ng ballpen kasi may tube yun. So, dun siya namihinga. Okay, I hope na napanood nyo to because this scene is actually medically approved. Okay, for emergency situation, this one will be a good choice. Okay, what else? There are actually different types of tracheostomy tubes. So, we have the single lumen tubes, so double lumen tubes, uncuffed tubes, and we also have cupped tubes. What else? We have fenestrated tube, adjustable flange tube. So, isa-isayin po natin yan i-discuss. So, here, makikita ninyo sa may first picture natin, sa may baba, and this is what we call the single lumen tube. Bakit po siya tinawag na single lumen? Because it is just a tube. Okay? Tube lamang po siya. I mean, isang tube lamang po siya. For example, this one is actually double lumen. Okay, double lumen tubes po siya. Ang single lumen is isang tubo lang siyang ganyan na pinasok. Okay, as you can see in this picture, isang tube lamang po siya. Okay? While the double lumen tubes is, itong hawak ko ngayon, double lumen siya kasi we have the outer lumen and then we have the inner lumen or the outer tube and the inner tube. Okay? Okay, this is the double lumen tube and most of the time, ito yung nakikita ko in the hospital. As you can see here also in my background, si Mang Jerry, okay, ang gamit po niya rito is double lumen tubes. Okay, but the thing is, metal po ito. Okay, the one that I showed to you, this one is actually a hard plastic. Okay, but yung kay Mang Jerry here is, yeah, this one. This is actually metal. Okay, this one is metal, but the thing is, this is a double lumen tubes. Ayan. Okay, double lumen po siya. Okay, you might ask me, sir, what is the function of that? What's the advantage of using single lumen and double lumen tubes? There are pros and cons actually. Maraming pros and cons pagdating sa paggamit po ng mga tubes. Okay? If you're going to use it for a short period of time, you can actually, the doctor will choose the single lumen. Okay? Kasi sandali lang naman gagamitin yan. But for a long period of time, you're gonna need a double lumen tubes. Bakit? Kasi po, nililinis po natin ito. Unlike dun kay single lumen, isang tube lang yung nakapasok sa kanya. So, ang hirap yung pagkalilinisin. It's really hard to clean that one. Okay, but for this, the double lumen, okay, ang nililinis lang natin dito is this one. Okay, the inner tube. Okay? Okay, what else? For the single lumen, ang kagandahan nato na ma-maximize nato yung space, the diameter inside. Okay? So, na-maximize niya. Unlike this one, since double lumen siya, the inner tube add up to the space in the outer lumen or the outer tubes. Okay, so medyo constricted, not really constricted, but if you're going to compare it to the single lumen, mas masikip po siya. Okay, what else? Another pros in using the double lumen tube is that, okay, katulad ng sabi ko sa inyo kanina, madali po siyang linisin and you can actually use it for a long period of time unlike dun kay single lumen. Okay, mas madali po itong linisin. And aside from that, this one can be used, okay, kapag ang pasyente natin is ready na para magsalita. Okay, magagamit po natin itong double lumen. Okay, unlike kay single lumen. Okay, pero pinaka-rationale kasi kung bakit mas maganda ang single lumen is na ma-maximize natin yung space doon sa may tracheostomy. So, meaning to say, yung pumapasok na hangin at lumalabas is mas smooth kumpara rito since this one has a narrowed space. Okay? Unlike a single lumen. This one is also double lumen, but this one is plastic. Aside from that, it is a cuff tubes. Okay, bakit po siya tinawag na cuff tubes? Simple lang. Okay, meron po siya ditong cuff. Okay? Para saan po ba itong cuff na to? Okay, let me show you something. Okay. Again, this is a double lumen tubes. Double lumen po siya. Ayan. Bakit siya tinawag na double lumen? Here's the other one. Okay, the inner tube. Okay. So, what's the purpose of this? Okay? The cuff tubes. Para po itong sa may BP cuff. Okay? Lumolobo po siya. This one serve as a lock. Okay? At the same time, okay, hindi magkakaroon ng obstruction, hindi magkakaroon ng, what do you call this one? Hindi magkakaroon ng trauma kapag nagagalaw yung tracheostomy. Okay? Hindi magkakaroon ng trauma inside the trachea. Okay? Kasi kung merong cuff na ganyan, it is really placed. So, paano ba ito gumagana? Okay, I'll just add ito. Okay, we'll add an air. Para siyang sa may, kung nakakita na kayo, since naituro ko naman sa inyo before, yung sa may Foley catheter, okay, this one will serve as a lock. Yan, lumolobo siya. Okay, so kung this is the trachea, okay, if this is the trachea, as you can see in the picture, if this is the trachea, pinasok mo to, okay, magkakaroon ng trauma dun sa may paligid ng trachea kasi nagagalaw. But if you will add this cuff, okay, it will be placed securely. So nakasecure po siya. Okay? Mas secured yung tracheo. So if you're ready to pull it out or remove this one, okay, de-deflate mo lang din siya. Okay? That's it. So that is the cuff tubes. Okay, pag sinabi natin uncuff, okay, katulad na to. Okay, this one is uncuff, wala po siyang cuff. So nilalagay lang siya ron, and then there's a tendency na magkaroon ng trauma. So rarely na po na ginagamit ito. Okay, yung mga uncuff tubes. Pero for some emergency cases, tsaka for a short period of time, if you're going to use the tracheostomy for a short period of time, you can consider that one, okay, the uncuff. And also, as you can see here in the picture, okay, the second picture, it shows the uncuff tubes, wala po yan cuff. Okay, on the third picture, should I say last, as you can see, ito pinakita ko sa inyo na balloon. Okay, that one will serve as a lock para dun sa may tracheo. Okay, nang sa ganun, hindi siya nagagalaw and it also prevents the trauma inside your trachea. Kasi delikado yun. Later, I will tell you what are the risks and complications na pwedeng ma-encounter ng isang tao. Okay, what else? Okay, what are the other types? We have the fenestrated tube. Okay, so what do we mean by fenestrated? Okay, so fenestrated, as you can see here, okay, the difference between these two, well, aside na this one is metal, this one is plastic, okay, another difference between the two is that, as you can see here, wala siya ritong hole, or the fenestration. Okay, the other one, meron po siya ritong hole. Okay, ano ba purpose na to? Ito po yung tinatawag nating fenestrated tube. Okay, and also, if you can, nakikita ba sa camera? I do not know if nakikita sa camera. Yung mag-autofocus. Anyway, hindi nakikita. Okay, may nakasulat dito. Yan, FEN, that is fenestrated endotracheal tube. Okay? And also the size, nakalagay dito yung size. This one is size 8 for adult po siya. Okay? So, going back to the fenestrated. Okay? If itong tracheostomy na to, pumasok po rin sa may trachea, okay? Okay, pinasok dito. And then, tinanggal natin itong inner cannula. Okay? What do you think will gonna happen? Dito ba lalabas yung air? No. Dito po lalabas yung air. So, meaning to say, ang pasyente po natin na meron pong fenestration or fenestrated tubes, okay, pwede itong gamitin if the client wanted to practice speaking. Also, if the client wanted to know kung kaya na ba niyang makapagsalita or kaya na niyang makahinga sa may bibig or sa may ilong. Okay, another reason for the fenestrated is that mas maganda siyang gamitin kapag ang pasyente natin is ready na po magsalita. Okay? Yeah. So for this one, I'll just show you something. This is the fenestrated, but as you can see, if I'll remove the inner tube, wala po itong butas dito. Okay, just wanted to show you something. Okay, wala siyang butas dito. So meaning to say, ang pasyente natin, directly dito siya mag-inhale and exhale. Okay, so pag nilagay ko po ito dito, okay, malalaki yung fenestration, yung hole. So ang client natin is, dito na po siya mag-breathe in and breathe out. Okay, kapag ang client natin wanted to practice na yung paghinga or sa tingin niya kaya na niya, papalitan na po natin itong inner tube, papalitan na natin siya nitong tube na to. But as you can see here in this picture, or should I say in this video, okay, the difference nung tube kanina. This one, meron na pong hole, but this one, wala. Ito po yung ginagamit natin para ang pasyente natin ay makahinga sila directly in and out dito sa may tracheo nila. Okay, the tracheostomy. Pero kung ang client natin wanted to know na kung kaya na ba niya, gagamitin po natin itong inner tube na to. And as you can see here, naka-close po siya. Okay, so pag pinasok ko po ito, lock. Pag pinasok ko to, walang hangin na papasok dito at wala ring hangin na lalabas. Rather, ang pasok at labas ng hangin ay dito po manggagaling sa may tube po na ito. Okay, so if we're going to put it in the trachea, okay, dito na bali, in and out ng hangin. Okay, hindi na rito. But, if ever ang client po natin, mahirapan po siyang sabihin niya, medyo nahihirapan na akong huminga gamit ang aking ilong at bibig. Okay, so ang gagawin natin is, i-open lang po natin ito. Okay? And then, makakahinga na po siya dito. Okay? Ginagamit lamang po itong inner tube na to na merong fenestration. Okay? Kapag ang pasyente natin, po pwede na or nakikita na ni doc na, uy, baka pwede nang tanggalin yung tracheostomy na to. So, before that, kailangan pag-practicein muna natin yung client natin na huminga using the nose and mouth. Okay? Hindi kasi pwedeng basta mo na lang tatanggalin. Hindi pwedeng tatanggalin na lang kaagad ni doc yung tracheostomy. Okay? No, it's not. Okay, pero kung ang client natin, it's really hard for him na makahinga or breathe in and out sa may nose. Okay, papalitan po natin yung inner tube. Okay, kita ninyo the hole or the fenestration. Papalitan na natin to with this one, yung wala. Okay, nasa ganun. Pag pinasok po natin ito, close tayo sa may tube na to, ang hinga ng pasyente ay nandito. Okay? So what else? The last type of the tracheostomy tube is the adjustable flange tube. Okay, si adjustable flange, so far, bihira nga ako makakita ng ganun sa mga hospital. Okay, makikita niyo sa may picture na to. Ang adjustable flange po is na-adjust po itong flange. Ano ba yung flange? Ito. Okay, the neck flange. This one is the one that supports, okay, or should I say, anchor the tracheostomy or the hub sa may neck. Okay, sa ganun, hindi po pumasok or lumabas yung tracheostomy. Okay? So, that is the adjustable flange. Na-adjust po yung flange. Okay? Yun lang yun. Na-adjust lang. For this one kasi fix siya. As you can see in the video, naka-fix lang to. But for the adjustable, na itataas to, na ibababa. And mas mahaba po yung tube. Okay? Ng adjustable flange. Okay? So, let's talk about the parts of the tracheostomy. Okay? So, this one is the pilot balloon. Okay? And this is also the hub. Dito tayo nag i-insert ng hangin. Okay? So, for this one, if you wanted to use this, kasi one way po siya, no? So, one way pilot balloon. Okay? So, pagka prines mo ito, okay, doon ka pala makakapag-insert ng hangin. Okay? Doon ka pala makakapag-insert ng hangin. Okay, so this is what we call the pilot balloon. Okay, here also we have, yan, meron silang mga pilot balloon. This one is used to inflate the cuff. Okay, but for this one, as I have told you, the metal doesn't have. Okay. So, huwag kayo mako-confuse, ano? I'm using air here. Okay, I cannot use water because if ever na magkaroon dito ng puncture, ang tubig po pwedeng pumunta sa may baga. Okay, so what I'm using here is air. Kung matatandaan ninyo doon sa may Foley catheterization natin, ang ginagamit natin to inflate the balloon is water. Bakit? If ever na pumutok po yun, saan mapupunta? Sa may urinary bladder. Walang problema ron. Hindi tayo magamit doon ng hangin kasi delikado. But for this one, hangin din po ang gagamitin natin and not water. Pero huwag kayong mako-confuse because there are some tracheostomy na ang ginagamit po nila is water. Okay? There are some tracheostomy na gawin na makikita ninyo. So far, wala pa ako nakikita rito, but in some other countries, they are using the water valve po. Okay? Yung cuff, tubig po yung nilalagay. Okay? Pero very secured po yun na hindi siya mabubutas. Okay? Silicone material ata ang ginamit nila ron. Okay, so we have the pilot balloon, we have the 15 millimeter hub, we also have the flange, okay, this one, the tube hub, this is the tube hub, and we have the cuff, okay, to inflate. This one will serve as an anchor to the trachea, nasa ganon hindi po magkaroon, hindi mawiggle, hindi magkaroon ng movement, at hindi rin magkaroon ng trauma yung iyong trachea, okay. And also, inside the tracheostomy is the inner tube. Okay, so those are the parts of the tracheostomy. Let's now talk about the risks. Okay, tracheostomies are generally safe. Okay, but they do have some risks. Safe po yan. Meron din ako mga kapitbahay. May kapitbahay ako. I mean, isa lang yung na-encounter ko. May kapitbahay ako na meron siyang tracheostomy and it's really hard for him to speak up. Okay, hirap talaga siya sa pagsalita. Okay, pero there are actually ways naman to, how do you call this one? Makapagsalita pa rin naman sila. Okay, later we're gonna discuss that. Okay, tracheostomies, generally speaking, they are safe. Okay, but they do have some risks. Some complications are particularly likely during or shortly after surgery. Okay, usually doon nangyayari yun eh. I encountered or I handled some operations in the operating before, some cases ng tracheostomy. Okay, so far wala naman ako na-encounter na nagkaroon ng problema. Okay, pero most of the time kasi doon lang nagkakaroon ng risk eh. Kung ang surgeon, kung ang doktor po na gumawa ng procedures magaling talaga, na i-place niya talaga ng maayos yung tracheostomy, so far wala magiging problema yun. Okay? The risk of such problems, they greatly increase when the tracheostomy is performed as an emergency procedure. Okay, katulad nung sinabi ko sa inyo kaya sa may anaconda scene, okay, usually dun sa mga emergency cases, dun lang nagkakaroon ng maraming mga risks. Okay, pero kung magaling talaga yung doktor, as I have said, usually, baba lamang po yung risk. So, ano ba yung mga risk na pwede natin ma-encounter? Number one is bleeding. Okay, kaya ginagawa po ang tracheostomy sa may operating room. Because in the operating room, andun lang yung mga materials or equipment na kailangan natin in performing the tracheostomy. Later, I'm going to show you a video how the doctor perform the tracheostomy. Okay? The tracheotomy and how to place the tracheostomy. Later, I will show you that video. Okay? Kung walang instrument, okay, risk talaga ang pasyente natin for bleeding. Okay, lalo na at meron tayong mahihit dyan ng mga ugat. Okay, risk ang pasyente natin for bleeding if we're going to perform this one in an emergency situation. Okay, what else? Damage to the trachea, thyroid gland, or nerves in the neck. Possible din po yun. Okay? Misplacement or displacement of the tracheostomy tube. Pwede rin mangyari yun. Kaya nga, nowadays, ang ginagawa na is, we are, what? Using the cuff tracheostomy. Okay? Mas maganda kasi kung merong cuff. At least, kung merong cuff yung ginagamit natin, mas mababa yung misplacement or displacement ng tracheostomy tube. Okay, what else? What are the other risks? Air trapped in tissue under the skin of the neck. Okay, this is what we call the subcutaneous emphysema. Okay, pwede magkaroon ng trap. Kaya yung ginagawa namin dyan in the operating room is, yung doktor talagang tinatahi po yun. Okay? What else? It can cause breathing problems. Okay, yung air trap na yan. Okay, and also damage to the trachea or the food pipe. I remember yung landlady namin, meron kasi siyang tracheo eh. Okay? Naalala ko lang yung landlady namin, meron siyang tracheo. Pero what happened is, since matagal na siyang merong tracheo, siguro nagkaroon ng problema with the placement. Okay, so what happened is, nagkaroon ng tracheal stenosis. Okay, and aside from that, yung trachea, matanda na kasi yun eh. Yung trachea niya, nagkaroon ng butas at nagkaroon ng fistula, or nagkaroon ng if this is the trachea, this is the esophagus, makadikit to, but the thing is, nagkaroon ng hole. So, yung kinakain niya, some part of ng kinakain po niya, is pumupunta doon sa may esophagus. Okay? Doon sa may trachea. Okay, so what happened is, some foods, tsaka yung iniinom niya, pumupunta rin sa may lungs. Hanggang sa nagkaroon po siya ng pneumonia, and then later on, sadly, kasi hindi na siya naagapan, nagkaroon ng atelectasis. Okay? So, it's really important, guys, na secured po yung pagpe-place natin ng tracheostomy, and then there's a proper care. Okay, don't worry, I'll teach you guys how to properly care for the tracheostomy. Okay, so what else? Build-up of air between the chest wall and the lungs. We call it the pneumothorax. It can really happen and it can cause pain and breathing problems, or worse, the atelectasis, o yung tinatawag natin na lung collapse. It can really happen. Okay? What else? A collection of blood, or what we call the hematoma, which may form in the neck, okay, and can compress the trachea, causing breathing problems. Usually, the collection of blood usually happen kapag hindi maganda yung pagkaka-opera ng tracheotomy. Okay? It usually happen kapag ganun. Pero, as I've said, if the doctor is specializes or know how to perform the tracheotomy, okay, mababa yung risk na yun. Okay? What else? What are some other complications? Well, long-term complications are more likely happen, okay, for a longer, what I mean is for longer use of the tracheostomy. Okay? These problems may include the obstruction of the tracheostomy. Okay, pwede magkaroon ng obstruction dun sa may tracheostomy. Okay, obstruction from what? Obstruction from the secretions. Okay, what else? Displacement of the tracheostomy tube from the trachea. Baka ma-dislodge. Okay? Kaya nga, importante na meron tayong cuff. Okay, what else? Damage or scarring or narrowing of the trachea. Pwede rin mangyari yun. Infection around the tracheostomy, or infection in the trachea and bronchial tubes. We call it the tracheobronchitis. And yun nangyari rin sa may landlady namin, the pneumonia can really happen. Then later on, kapag hindi naagapan, pwede magkaroon ng atelectasis. What else? Development of an abnormal passage between the trachea and the esophagus. Ito yung nangyari rin sa may landlady namin. Okay, we call it the tracheoesophageal fistula. Nagkaroon po ng passage. Okay, it's really risky, especially if the client is taking foods. Okay, it can increase the risk of fluid or food entering the lungs. Okay, what else? Okay, lastly, development of a passage between the trachea and the large artery that supplies blood to the right arm and right side of the neck and head. Okay, we call it the tracheoinnominate fistula. Okay, it can result in a life-threatening bleeding. Okay, delikado rin po ito. Okay, pero usually it happen sa mga client natin na matagal nang merong tracheostomy that are placed in their neck. Okay, I mean in their trachea. What else? Let's talk about the post-op care. Okay, if you still need a tracheostomy after you left the hospital, okay, discharge ka na ng doktor mo, well, you'll need to keep regularly scheduled appointment for monitoring the possible complications. Okay, sasabihan ka naman ng doktor, okay, kung kailan yung next visit mo. And also, you will receive instructions about when you should call your doctor about your problems, such as bleeding at the tracheostomy site or from the trachea, bigla na lang dumudugo. Okay, or nagkaroon ng dugo. Delikado yun. Dapat kasi wala. Kasi sutured po yan or tinahi. Okay, what else? Difficulty breathing through the tube. So, dapat smooth yung paghinga mo. Kasi meron nang nakalagay na tube. Dito ka na dapat humihinga. Pero, if ever nagkaroon ka ng problema or hindi ka makahinga dito sa may ET tube mo, okay, there's really a problem with that. Baka merong blockage. Okay? What else? Pain or a change in comfort level. Okay, kailangan din yan. Okay, if mangyari yan, you really have to call for your doctor. Okay, or redness or swelling around the tracheostomy. Okay, ano pa? A change in the position of your tracheostomy. Biglang nagbago yung placement. Okay, nagkaroon ng displacement or misplacement na yung ET tube. Maybe nagkaroon po ng sira doon sa may cuff natin or doon sa may anchor, the balloon. Although it's really tight and also this one is matibay. Okay, as you can see, kahit i-pinch ko yan, matibay po ito. Okay, pero if ever na magkaroon lang ng puncture, okay, magkakaroon din ng displacement. Okay, what else? After the procedure, you will likely spend several days in the hospital. Okay, hindi po pwedeng after the operation, uwi ka na. No, you cannot. Okay, your body needs to heal. And also, your body needs to adjust. Okay, during that time, you'll learn skills necessary for maintaining and coping with your tracheostomy. Okay? So, after the procedure, expect mo that there will be some instruction about the caring for your tracheostomy tube. Okay? The nurse or even the speech therapist will tell you about the proper care of the tracheostomy tube. Okay, tuturuan ka paano ba mag-care. Okay, yun yung i-demo ko sa inyo later kung paano ang paglilinis ng tracheostomy. Okay, what else? Speaking. Since merong tracheostomy na nakalagay sa'yo, okay, kapag ka nagsalita ka na, it will become hard for you to, what do you call this one? Speak up. Okay? Why? Okay? Ang pasok ng hangin ay dito. Ang labas ng hangin ay dito. So meaning to say, hindi lalabas yung hangin doon sa may vocal folds mo. Okay? Kahit gusto mong mag-articulate, okay, kahit gusto mong magsalit, no matter how you try to speak up, okay, hindi ka makakapagsalita. Okay? Kasi ang hangin lalabas po dito. But as I have said kanina, if you are ready, papalitan natin yung inner tube. Noong this one, the one with the hole, the fenestrated. And then of course, lock dapat ito. Nasa ganun, dito na yung air lalabas. Okay, mas makakapagsalita ka. Although, hindi ganun kadali ang magsalita. That's why you need a speech therapist or a nurse that are specializes when it comes in the tracheostomy. Okay, hindi po ganun kadali ang magsalita kapag ka merong tracheostomy. Okay, na place dun sa may tracheotomy mo. Okay, as you can see in this picture, okay, this is actually a valve. Itong valve po na ito ay nilalagay po dito. Okay. Okay, nilalagay po siya dito. Okay, yung valve na yan, pag pinasok mo, unfortunately, hindi available ngayon sa manual natin, wala tayong ganyan. If you put that valve here, okay, pag huminga ka, okay, mag-open yung valve, papasok yung hangin. Pero kapag ka magsasalita ka na, magko-close po yung valve, so ang hangin ay lalabas po dito sa may fenestration or dun sa may hole. So meaning to say, ang hangin ay lalabas po sa may bibig at saka sa may ilong. Mas makakapagsalita ka. Okay? So yan yung purpose nitong valve na to. Okay? It will become easy for you to speak. Ano pa? Eating. Okay? Expect mo na if you are still in a hospital, ang pagkain mo ay hindi po didiretso sa may bibig. Kasi mahihirapan ka pa rin dyan ngumuya at lumunon. Okay, try to imagine, meron ka ditong, may trauma dito, nagkaroon ng incision, so merong trauma po dyan. Okay, it will become hard for you to use that muscles. Okay, so medyo mahirap ka pa rin dyan sa pagsasalita. Okay, so most of the foods and nutrients ay manggagaling po rin sa may, yeah, as you can see here, yeah, this one. Okay, you're gonna use we'll use the IV fluid. So dyan daraan yung nutrients mo. Aside from that, the doctor will instruct to use a nasogastric tube. Okay, naka-NGT ang pasyente natin. Nasa ganun yung pagkain, diretso po dun sa may stomach. Hindi po ganun kadali yung, what do you call this one? Hindi ganun kadali yung pagkain. Okay, the eating habits, hindi madaling ibalik yung eating habits. Okay, what else? Coping with dry air. Okay, ang humidification po, ang humidification, we are familiar with that. Kaya ang humidification ay nanggagaling po sa may nasal cavity po natin. Okay, yan yung purpose ng ilong natin. Okay, yan po ang nag-humidify dun sa may hangin na nilalangap po natin. But since ang pag-inhale and exhale po natin, ang pag-inhale is direct na po dito sa may tracheo, walang humidification na nangyayari. Hindi kayang humidify ng ilong yung hangin na pumapasok dun sa may baga natin. So meaning to say, magkakaroon po ng dry air. If ever na magkaroon ng dry air, it may irritate the trachea. Okay, so it may irritate the trachea, baka ubuhin yung pasyente natin. So it takes time for you to cope up with a dry air. So there are many ways naman para makapag-cope up ka dyan eh. Meron pong ginagamit na mga devices para ma-humidify yung hangin na pumapasok. Okay, what else? The O2. Yes, this. Okay, we have here the oxygen. Yeah. Okay, so the oxygen. Okay, meron po tayong special na device kung saan yun po ay ko-connect doon sa may trachea. Tracheostomy. Okay? So there will be some humidification na mangyayari. Okay? What else? You can also instruct the client na meron pong tracheostomy na pwede silang maglagay ng konting tubig sa may inner tube. Okay, they may add some water. Okay, wag directly po Okay, baka pumunta sa may lungs, lalo na kung marami. Konting tubig lamang. Okay, we can instruct them to put a water. Okay, some water there. Okay? Nang sa ganun, ay magkakaroon ng humidification doon sa may hangin niya. Ano pa ba? What are the other ways? We may use RG. Yeah. So, babasain mo lamang yung RG, tapos medyo itapal mo rin sa may tracheostomy. Okay, tapal ng konti, and then hingang malalim. Nang sa ganun, ma-humidify kahit papano yung trachea. Okay, so after a few breathing, you may remove the wet gauze. Tandaan i-wet mo lamang yung gauze, and then inhale, exhale. Okay, wag mo directly papasok dun sa may tracheostomy. Okay, what else? Managing other effects. Okay, kung bago lang na nakalagay, if the tracheostomy is newly inserted in the trachea, okay, there's a possibility na magkaroon po yan ng build up ng secretions. So, how to manage those secretions? Well, magkakaroon ng suctioning. Okay, meron ba tayong suction machine? We have a suction machine here. I'll just show you a video. Yeah, right over there. That is our suction machine. Maybe I'll just show you a video. Maybe by next week na, I'll show you a video on how to do suctioning of the tracheostomy. Kasi isa yun sa mga ginagawa ninyo in a hospital. Although, very rare na maka-encounter kayo in a ward na meron pong mga tracheostomy. Pero if ever lang na maka-encounter kayo, at least alam niyo yung gagawin ninyo. Hindi kayo mapagalitan ng clinical instructor ninyo. Or maybe, kapag ka-nurse na kayo at maka-encounter kayo na may tracheostomy, at least alam niyo yung gagawin ninyo. Okay? So what else? Some results, okay, after the tracheostomy. In most cases, a tracheostomy is temporary. Temporary lamang naman po yan. Okay, temporary. Providing an alternative breathing route until other medical issues are resolved. Well, your healthcare team will help you to determine when it is appropriate to remove the tracheostomy tube. Si Doc po ang mag-decide niyan, and si Doc din ang re-remove ng tracheostomy. Kapag sabi ni Doc is ready na for the removal, okay, the surgical team will do the rest. Okay? If you need to remain connected to a ventilator, definitely po. Okay? I mean, indefinitely. Okay? The tracheostomy is often the best permanent solution. Pero kung temporary lang, katulad ng sabi ko sa inyo kanina, we can use the ET tube. Okay? The endotracheal tube. We can use this one. Okay? So, how it is being done, I will show you here a video before we move on to the return demonstrations of the tracheostomy care. Before we move on to the return demonstration, I'll just show you guys a video paano ba ginagawa itong tracheostomy. Okay, the tracheotomy and then the placement of tracheostomy. So for now, hanggang dito lamang muna. I will just show you guys a video kung paano ito ginagawa. And I assure you guys na if ever na ma-encounter natin to in the operating room, almost ganito po ang ginagawa namin, or should I say natin, in the operating room. Okay, I'll just show you a video of this. Saglit lang. So, this is a tracheostomy incision, is tracheotomy. So, this is the procedure na ginagawa natin in the operating room. Here, we will check kung saan tayo magkakaroon ng incision. First, there will be an incision, and then it will be open. So, the instrument that they are using here, kailangan po natin ng cautery to prevent, of course, bleeding. Here, as you can see, ito yung fascia. So, it is being divided. The doctor will identify the strap of muscles and retract laterally. So, here they are using 3 retractors. If ever po na makita ni Doc, or if ever na there is a thyroid gland, it is required to at least make a separation or retract it. Again, we will use a cautery. This will prevent bleeding, and at the same time, yung ginagamit dito is cautery pencil para mas maganda ang incision natin. So be sure to inflate the cup to check for the balloon, deflate it, then advance the tube, or should I say insert it and then reflate the cuff. So in incising the trachea, we are looking for the second and third tracheal ring. Then ready the suction tip. Then here they are creating the Vork flap. Suction again. The Vork flap will be sutured or tatahiin po yan dun sa may skin. Sa ganun, it will serve as an anchor. Then, continuous ang pagsasuction ng blood. Then, once ready, we will now insert the tracheostomy tube. I forgot to mention about the obturator. Maybe I'll just explain it to you guys next week, since babalikan pa naman natin to for the tracheostomy care. Now, once the trach has been inserted, we will now connect the oxygen. Be sure to confirm the placement. And then last, the surgeon will secure the tracheostomy tube, what you call this one, the flange. And then strap it. This will secure the tracheostomy. So here are some key points for the tracheostomy: communication with the anesthesia provider, adequate exposure of airway, and control transition between ETT and then the tracheostomy tube. So guys, that ends our discussion. Before we end this presentation, I would like you to know na ready na po ang mga materials natin dito sa may nursing arts laboratory natin. We have all the materials. We have Kuya Jerry, the mannequin. We also have there. Okay, sila Mrs. Jace. Our nursing arts laboratory has 4 mannequins na meron po silang tracheotomy. We also have Juno. We have Mami Chase. We have Jerry. Okay, they are capable of providing us a tracheotomy kung saan mag-insert tayo ng tracheostomy. Unfortunately guys, COVID-19 pa din, so hindi pa rin tayo po pwede na magkaroon ng face-to-face. I hope mawala ng COVID-19 na sa ganun guys. Magkita-kita tayo dito sa may bagong nursing arts laboratory natin. Okay, that ends our discussion. Maraming salamat. I hope you've learned something. Next week, I'm going to demonstrate to you how to properly care for the tracheostomy and also to do suctioning of the tracheostomy. Okay, so that's it guys. Maraming salamat. I hope you learned something or many things today. That ends our discussion. Maraming salamat. That's it guys. God bless.